Hello, hello. Welcome to Let's Hangout. I'm Sharmeen Thomas and I'm with Indoz TV. Today's episode of Let's Hangout focuses on a different aspect of lifestyle, yet I can tell you that it is the most important aspect, your healthcare. So today we're talking about research that pertains to genetics, to heart disease, and how you as the South Asian community can help to improve healthcare and deliver a brighter and better future for the generations to come. What are we waiting for? Let's get started and let's meet our guests for today. We have with us Dr. Sonia Shah, who spearheads the study. We have with us Dr. Vaishnavi Nathan, and we have with us Vrinda Sane. Welcome to the show, ladies.
Thank you.
Thank you.
The study we're talking about today is called the South Asian Genes and Health in Australia study, which is a first of its kind. It's a pilot study being conducted in Queensland. Let's meet the people behind the study today. Let's start with you, Sonia. As the lead of this research project, give us a little overview, one, about your background and also what the study is all about and why is it so important?
Okay, so a little bit about me. I'm a Gujarati Indian who was born and brought up in Kenya. I'm a British national, but call Australia my home at the moment. And I've got two jobs actually, full-time jobs I would say. I'm a scientist, but I'm also a mum. But in terms of my profession, my science profession, I work in genetics research with a big focus on heart disease. And heart disease is very important to me. It's something that's in my family. But also as a South Asian, I think this study is really about making sure that we are represented in health and medical research. And why that's important? Well, everything we know about disease, how we treat it, who we treat, what medications we give, all that knowledge comes from doing health and medical research. And until now, really, the research that's been done has been very much biased towards heart disease in men, but also heart disease in people of mostly European ancestry. And we know that risk factors can vary across men and women, but also different ancestries, and how we treat people can also, how we respond to medication can be different as well. But if we don't have a diverse representation of different ancestries, but also women in research, our medical guidelines, how we treat people is going to be biased. So this study really is about ensuring, as South Asians, which makes up a significant proportion of the Australian population, that the guidelines, the medical guidelines, are also tailored for this population.
That's very interesting, and of course the focus of this study is the South Asian population. And I understand this is the first study of its kind in Australia.
Yes, that's right. This is the first sort of study that's focused on South Asians and also sort of including genetic information on South Asians.
Right, and talking about genetic information, Vaishnavi, welcome to the show. So you are a genetic counselor with about 10 years of research experience. So enlighten me, Vaishnavi, what do you do as a genetic counselor? Because I've only heard of other types of counselors, but not genetic counselors. So, what is your role in this project? What exactly do you do, and what does it entail?
So I'm a research genetic counsellor, and Vrinda can probably speak a little bit more about clinical genetic counselling and what we might do in a health and clinical setting. But in a research setting, we genetic counsellors, we communicate risk information to patients and their families. And so in a research project, I'm able to do that to our participants. So I can explain information in a way that is accessible, understandable, and to try and understand what they might understand, to try and make sure that they know what it means for them and their family, and also to try and help them with their decision making, because that's something that genetic counsellors do. We want to try and empower people with information and make sure that they are doing the thing that's best for them and that fits with their values as well. So that's what I do in my research project.
Have you always worked in genetics, or what did you do before sort of moving into this study?
Yeah, good question. I did my honours, so a research project that is about 10 months in science and in cancer biology. and then decided to do my PhD in melanoma genetics, which is a type of skin cancer, and it's quite prevalent in Australia, especially in Queensland.
Right.
And I really liked the work that we were doing because we looked at family studies. So we looked at individuals within a certain family group who may have a really high susceptibility or risk of developing cancer. And because I enjoyed that so much, I actually really wanted to work with people,
Yes.
and that's why I decided to do genetic counselling. And my years of experience in research has mostly been in the lab without people. So it's really nice to be able to work with community and speak to people about genetics and research.
And the community focus is obviously a very important element of the study because, like you said, you can sit in a lab or you can sit in front of a computer and do all of that. But till the time you don't know what the people out there, that's where you get your information from. And so coming to that, Rinda, welcome to the show once again.
Thank you.
It's a pleasure to have you here. You work more sort of in the field. Would that be correct to
Yep.
say?
Yeah.
What is your background? How does your role integrate with the research project?
I am a clinical genetic counsellor, as Vaishnavi said. So I work at Genetic Health Queensland, which is at the Royal Brisbane and Women's Hospital, and I see patients who have family history of a genetic condition or there may be a risk to health because of genetic issues. So genetic counselling, I feel the counselling in there is,
Yes.
it's about communication. So the ideal word could have been a genetic communicator because there is not, I suppose when we think of counsellor or psychologist in a traditional way,
Yes.
genetic counselling is more focused about what this means for the patient and how it fits in their life. So coming to the second part of your question, for this research study, I'm wearing a completely different hat. So I really appreciate Saga's study as it is done so closely with the community. I'm here in the role of community advisor. And when I heard about the study, the cause was so close to the heart, pun intended. But, coming from Southeast Asian ancestry and seeing there is so little genetic research about us, but being a community advisor is, Sonia and Vesh has really integrated the community to be part of what the pillars on which the research has been built. And coming there in perspective of community with understanding of genetics. So there is a group of 5 of us, is that correct?
Yes.
Yeah, and we are from Indian, Bangladeshi, Sri Lankan, Pakistani, and Fiji Indian ancestry. So it's a good mix.
And
a
that's
few.
what essentially your study is representing.
Yeah. And the community advisors are from there, and I think 3 of us are from medical background, and 2 are beautiful community advisors, which give us idea of what the participants would think like and what their questions would be. So my role is as genetic counselor, but in this project I come as part of the community, sort of bringing in. It's hard while you have 2 hats to remove one completely and take another one out.
And you bring in your clinical experience of years.
Yeah, a
into
bit
this
in
project,
terms
yeah.
of, for example, I feel people would be very interested in participating in research like that, and more would be interested those who have family history because it
Yes.
takes the curiosity. So having that little bit insight, but otherwise, yeah, I've really enjoyed coming to it from part of community angle.
Not just that, families are so widespread nowadays. Like you could be living here and you have family in the US, in the UK, and your aunt somewhere has been diagnosed with something, and you may or may not know something. So I think it's absolutely, it's essential to know this kind of thing. What is the ultimate objective of this study?
So, this study is really focused on heart disease because it is highly prevalent in the South Asian community. But the tools that are used currently by doctors, like I said, it's based on research done, which doesn't include a lot of South Asian individuals. So the long-term vision is that we have a study that's large enough, so it's got sufficient participants to actually help us change some of the guidelines to make them more optimal for South Asians so that we can better prevent disease, we can better treat disease. But it's also about raising awareness that heart disease is prevalent. And we should, I think there's a sort of misconception that it only happens when you're much older. But as South Asians, actually type 2 diabetes, but also heart disease starts at a much younger age. So starting to think about this much younger and ensuring there are ways you can reduce your risk. Even you can't really change your genetics, but there are many other lifestyle factors you can change. So if you are at high genetic risk, there are things you can do to reduce that risk.
At what age should someone actually start worrying about this, or like the people who are actually part of your research, the community that you're trying to involve? What is the ideal age for that?
I don't know what is the ideal age you're thinking about health. I think that the younger you are. In fact, for me, having 2 young kids, I am instilling that in them right now by teaching them healthy eating habits and being active. I don't think there's ever you're never too young to learn about being healthy. But in Australia, you can go to your GP, you can get heart health checks done to look at whether you're at risk or not. And the heart health check is available for people from 45 and above.
Right.
But as South Asians, we should probably at least, go and chat to your GP, especially if you have family history, from a much younger age. So even if you're in your 30s, if you've got a family history, you should be talking to your GP about it.
I think that awareness is very important, and we're all sitting in this room. I think we're all in our 30s and 40s, and I think that question just really came from me. Like, what is the ideal age when you should actually have this serious discussion with your GP? Coming back to community, and you've been running focus groups, and you talk to between focus groups and talking to the community, is that the only way you're reaching out to the community, or have there been other means that you've actually been able to get the community involved?
We've been trying lots of different ways. We think that that's a really important way of reaching parts of the community that may not have heard about the research. So we reached community leaders. Sonia spoke to them before she even got the research project grant and the money that came for the research project. We've spoken to community leaders. We've been trying to go to a lot of their events and various festivals. We're all South Asian ourselves, so we understand.
It's a double incentive to
and so it's not just the focus groups discussions as well as the community advisory group, but really trying to be involved and meeting the community where they're at, and not expecting them to come to us. We want to be on the ground doing that work with them as partners. And so that's, I think you asked Sonia before what the main goal of the project is, and the other half of that goal is to really engage with community, have them involved, understand if they would like to be interested in and participate in a research study that is to benefit future generations living in Australia. Because if the guidelines don't change for us, then
it's not the correct representation.
Exactly, and that gap that we have in terms of our healthcare will only get wider and deeper as well.
And given that there's obviously very limited data on the South Asian population within the heart disease data. Sorry. So have you faced any particular challenges from the community? There's obviously a reason why we don't have this data. One is maybe because the study hasn't been done before here in Australia. But have you faced any kind of reluctance from people, or any challenges and the perception that you might want to see change?
I have enjoyed being part of research because I've felt it is so integrated with the community. And one of the things, I suppose, a challenge would be the field of genetics itself. We are talking about single gene, monogenic causes, polygenic markers. These things have come. So the language of healthcare has changed in a way. And genetics is such a cutting edge science, which is, I've started working for last 10 years. And the test we used to do from single gene to now panels to exomes and trios had changed in a small amount of time significantly. So having that community involvement makes people assure that the people who are doing this research are talking about the stuff that is in the interest of welfare of the community. And it's a together thing that we are going to go forward to. Because participation in genomic research for average person it's hard to comprehend. I feel those terms have changed too fast for medical professionals to keep up with, so they would be hard for people in general population. So I think that's where a part of the gap comes from.
Yeah, and I think maybe a lot of people will sort of resonate with this, is that generally South Asians, they don't like talking about health. you don't want to public
health or money.
No, you don't.
Or what you do.
Yeah, and that question you asked about knowing your family history, a lot of the time we don't know because we don't like talking about it. So it's important to have those conversations because it could help sort of future generations. And so even that lack, not wanting to participate in a study, many factors that contribute to that. But not, health sometimes can be a taboo topic to talk about, and so participating in a study that's about health is, that's a sort of a barrier to participation. But it's not just with the South Asian community, just generally people from minority groups are underrepresented in health research. So worldwide, there is a big initiative to try and get more diverse people to participate in research. And we're doing this in Australia, but there are South Asian focus studies already being done in the UK and in the US.
Does that data help you in your study as well?
Yeah, so eventually, we are hoping that, through collaboration, because when it comes to this sort of research, the bigger the number of participants we have, the more data we have, the more accurate we can the knowledge we have as well. So by collaborating worldwide and bringing data sets on South Asians from different countries is going to help with that.
And how can we, I'd like you to actually tell our viewers today how they can get involved in this study, because like you said, awareness is the key issue. So is there a link that we can sign up to? We can of course share it by way of this video, but how, tell the people what you want to tell them.
So people can sign up by visiting the website
Yeah.
and clicking the register now button and expressing interest, which is very basic information, but it's just to check eligibility or a specific criteria. And the whole goal is to improve healthcare for our future generations. And so what they can do is they'll get a link to participate, and then they can read a participant information sheet and consent form. And that just has a lot of information about what the study entails. We developed this with combination with the community advisory group, and we have a lot of frequently asked questions on our website as well, so there's a lot that some people might not fully understand that they can find out more. They can also contact us if they have any information, and then they do a questionnaire, a sort of health survey, which takes about 20 minutes, and then they can provide a blood sample. And after all of that, they can choose to receive the results of their study information or not, which is about their traditional heart risk factors as well as genetic risk factors for a specific condition. And if they don't want to find out, they don't have to. They can just donate to the study and be a part of the research project. But if they would like to find out their risk of heart disease and more about their heart health, then they can do that, and they've got the opportunity to.
And is there any particular selection criteria? I know that's part of your screening process, but anything that people should just, or is it just anyone who can be a part of it?
They have to be of South Asian ancestry, and that just means having Indian, Pakistani, Sri Lankan or Bangladeshi heritage. So a lot of people might wonder, I think you asked this before, Sharmeen, is, what about people like us who aren't living in India anymore, or may have been brought up in a different country and then moved, but we've got Indian roots. So as long as you've got ancestral roots and heritage to one of those countries, then you'll be eligible. You also have to be over 18 years of age and living in Queensland, Australia,
right?
Because this is a pilot study and it's just for a small group at the moment, and then it will hopefully have more funding for future studies for the whole population.
And it is restricted at the moment to people who are permanent residents and citizens. And that, again, that decision was made after chatting to community members about, potential concerns if you're not, in terms of, following up any things that we identify, if somebody is at high risk, being able to follow them up in the healthcare system.
Right.
It can be costly if you're not a citizen or a PR. So that's been, we would love to have included everyone because, like I said, knowing your risk, you can do things to change it. But this is, again, a decision that we made very carefully after community consultation.
And from focus group discussions and community advisory group discussions, some people were worried about what that information might do to applying for a visa or applying for residency in Australia. So we don't know yet about that information and how that might affect their application, and we don't want any information to sort of hinder that. And so again, we've wanted to try and protect people and their data.
Absolutely, that's a lot of careful consideration, and you've got to take the right call. What is the future of the study? If we've got to sum it up.
Mm-hmm. Well, like I said, the sort of long-term vision would be to have enough participants of South Asian ancestry in Australian research that we can actually make changes to the medical guidelines. But really for that, we need a much larger study. So this was a small study, which was, it was all about us learning how do we go about doing research with this community? How do we engage with this community? Is there interest? And we know that there is a lot of interest. So, like all research, it's very dependent on funding. And so eventually, once we finish the pilot study, we're hoping to try and get funding to go nationally and recruit from other states as well.
So Vesh, you mentioned blood samples. Is it like, how does someone get their blood sample to you?
So we're trying to do things differently with the research project, and that's why we've gone to the community and asked them what they would like and how they want to participate. And so we've got different ways that people can participate. The way that I think most people will want to participate is remotely. So wherever they are, they can get in Queensland, get a sample kit sent to them via post. They can take that kit to their nearest pathology centre, collection centre, and get their blood taken there. And they'll be able to post that back to us, to the lab, and we'll be able to receive that all okay. So it's very little contact with the team if need be.
And it's pretty easy because I think people are pretty busy in their lives, and they might think, like I would have thought that, I need to put aside half a day or one day to be a part of this research. But I think this makes it really fairly accessible for people, and I think that's the key word.
And the other, accessible is what we'd like to sort of improve with research. And the other way that people can participate is by attending an in-person community event. So we've already had 2 in-person events where people have been able to come, meet the team, provide consent, ask any questions if they have, and then give a blood sample to staff that we have available there to take blood.
And how do people get to know about where you're running these little community meets?
We have them advertised on our website. So the next one hasn't yet been organised, but we'll hopefully be able to do at least one more before the project finishes, so that anyone who's interested can come to an in-person event as well. And some people have also found out about the study through their GP. We have especially one GP very involved and encouraged, and very involved and involved with the. I can't speak. We've had one specific GP who's been very involved and enthusiastic, and supportive
in
with the
sharing
project.
the message.
And so he's been telling a lot of his patients about the project. So anybody who's a health professional and a GP may be able to tell their patients as well if they're interested.
And I just wanted to add, there's no cost to participation, apart from obviously donating us your time and your blood sample. That's
absolutely very important to know. Very important to know.
Yeah.
Thank you so much for your time and your insight today, ladies. I think this is something so beneficial for the South Asian community. So hats off to the hard work that you're putting into all the long, tedious hours of research, of focus groups, of community engagement. Well done, all the best. We will share your links, your website, so people can sign up. Thank you so much for being on my segment, Let's Hang Out.
Thank you for having us.
Thank you so much. That was wonderful.